Hello friends, today we are going to discuss about cardiac cycle in the subject physiology. It is a very important question for 10 marks in the university examinations. Okay, so let us discuss this under the following headings. We'll discuss first about the definition of the cardiac cycle, then we'll discuss about the phases of the cardiac cycle, then we'll discuss about the pressure changes, most important pressure changes in the ventricles, then we'll discuss about the pressure changes in the atrium, okay, of the heart, then we will discuss about the pressure changes in the aorta, okay, and also the volume changes in the ventricles, and then finally we will discuss about the ECG changes. Okay, ECG, that is we will correlate these changes, the pressure and the volume changes along with the ECG. Okay, so ultimately we will discuss with reference to this graph. Okay, so whenever there is a question of the cardiac cycle, you are supposed to draw this graph. So it looks very much clumsy, like so many things in one together, like in such a duration of 0.8 seconds, so many pressure and volume changes. So we will try to make it simple. So please give your kind concentration. The length of the lecture may go a bit long, but it's worth to read this. Or moreover, I want to share you the notes also. So in the Telegram channel, we have already shared this PDF of cardiac cycle. So in that, the competency number PY 5.3 discuss the events during the cardiac cycle under this objective, that is the definition of cardiac cycle, phases of the cardiac cycle, and all we have discussing today, and already this has been shared. So those who want this notes, so please subscribe our channel Doctor's Corner. In the description of the channel there is a link for the Telegram channel, and in that we have provided the PDF, that is the same notes, handwritten notes of the cardiac cycle, very useful and handy. So let us first try to understand the phases of the cardiac cycle and correlation about the details about these things, right? So first, definition of the cardiac cycle. So cardiac cycle is the electrical and mechanical events, or the events which takes place during one heartbeat, that is the starting of the one heartbeat to the starting of the next heartbeat. You know, our heart will beat for around 72 times per minute. Okay, if we take around roughly around 75 times per minute, that is in 60 seconds. In 60 seconds, heart is beating, for the sake of calculation, just average 75 times. So for one time, how much if the or the beating of the one heartbeat, that is one single heartbeat, so it will take around 0.8 second. So the duration of the cardiac cycle is 0.8 second. And what is the definition of the cardiac cycle? The electrical and mechanical events that takes place from the onset of one heartbeat to the next heartbeat, it is known as cardiac cycle, right? Now what are the phases of the cardiac cycle? So usually and broadly there are two phases of the cardiac cycle: systole and diastole. Systole and diastole. Systole means the contraction of the heart and diastole means relaxation of the heart. But as you are aware that heart is made up of mainly four chambers, right? It is mainly made up of four chambers: atria and ventricles, two atria, that is the right atrium and left atrium. Then we have the left ventricle and right ventricle, right? So this atria and ventricles will contract separately. So we have atrial systole and atrial diastole, ventricular systole and ventricular diastole. Okay, so what are the phases of the cardiac cycle? So phases of the cardiac cycle are: first one is the atrial cycle, that is the atrial systole and atrial diastole. Now this atrial systole is around 0.1 second and atrial diastole is around 0.7 second, that is totally 0.8 second. So atrial systole and atrial diastole is around totally 0.8 second. Similarly, we have ventricular systole and ventricular diastole. Ventricular systole, which is around 0.3 second. Okay, more exactly it's mentioned as 0.27 second, but for the sake of convenience we will take it as 0.3 second, ventricular systole. Now again in this ventricular systole there are many events. Okay, what are the events in the ventricular systole? So it includes isovolumetric contraction period, isovolumetric contraction period or phase. So just right now, just concentrate on this different phases. Meanwhile, we'll explain all the phases and what are the pressure and volume changes during this isovolumetric contraction period, rapid filling phase, and all. But what we are going to discuss now. Okay, so the duration of this isovolumic contraction period is around 0.05 seconds. Okay, then that is during the systole. Then there is a rapid ejection phase, then we have the slow ejection phase, rapid ejection phase, then slow ejection phase. So this rapid ejection phase is around 0.1 second and slow ejection phase is around 0.15 seconds. So together it is around 0.3 second ventricular systole. So in the ventricular systole there is isovolumetric contraction and ejection. That is the blood from the ventricle goes to the aorta. We'll discuss that thing. Then we have ventricular diastole. Ventricular diastole, which constitute of around 0.5 second. Okay, it is 0.53 second, but we'll take it a round figure at 0.5 second. Again, there are subtypes or subphases in this ventricular diastole. First one is the protodiastole. Which is around 0.04 second. Then we have isovolumetric relaxation period. Isovolumetric relaxation, which is around 0.06 second. Okay. Then third thing is rapid filling phase. Which is around 0.11 second. Then we have a reduced rapid filling phase, that is also known as slow filling phase. Which is around 0.19 second. And finally this slow filling phase, it is also known as diastasis. And this is atrial systole. It will coincide with this atrial systole of 0.1 second. It is this last phase. It is also known as last rapid filling phase. This is around 0.1 second. It will coincide with atrial systole. Okay, so basically if you see even in the textbook of Guyton, you will find out this 7 phases of ventricular systole and diastole. Okay, so and we including that atrial systole. So basically what happens is total duration is 0.8 second. In this 0.8 second only, atria will contract for 0.1 second and relax for 0.7 second. In that same 0.8 second, ventricles will contract for 0.3 second and relax for 0.5 second. Okay, so there is coinciding of the atrial systole with the later part of the ventricular diastole. It's like this. Suppose this is total duration is 0.8 second, right? 0.8 second. In that atrial systole is 0.1 second and atrial diastole is 0.7 second. Okay, atrial systole is 0.1 second and atrial diastole is this one, and ventricular systole which will be coinciding with the atrial diastole, it is around 0.3 second, and ventricular diastole it is around 0.5 second, out of which 0.4 second coincide with the atrial diastole and remaining the last phase it is coinciding with atrial systole. This is also ventricular diastole. So when the atria in systole, the simultaneously the ventricles will be in diastole. That is, it is relaxing. Okay, when the atria is contracting, and when the atria is relaxing, at that time the ventricles will contract and also it will relax, and still ventricle is relaxing, atria will contract. So this is how the different phases coincide. So we have achieved the two objectives. Hope this first and second is clear to you. What is the definition? What are the different phases of the cardiac cycle? Okay, so basically we will discuss the mechanical events. Okay, that is the pressure and volume changes in the ventricles, in the atrium, and the aorta in the following phases of the cardiac cycle, that is in the atrial systole, diastole. So what will be the changes in the pressure in the ventricles during these phases and also in the atria, okay, simultaneously what will happen, okay. So let us discuss it. First we'll start with the atrial systole, that is the last rapid filling phase, that is this 0.1 second. So what happens in this 0.1 second duration, okay. So all the changes, pressure and volume changes, so we'll use this diagram to understand the pressure and volume changes. So let me just explain this diagram. So see, on the y-axis on this graph, there are markings in pressure in millimeter of mercury, 20, 40, 60, 80, 100, so and so. On x-axis, the time duration, okay, time duration in seconds, okay. So time duration in seconds. So it will be like see here, atrial systole is 0.1 second, atrial diastole 0.7 second, ventricular diastole 0.1 second, that is the last part, then ventricular systole 0.3 second and ventricular diastole 0.4 second, okay. Diastole means relaxation, systole means contraction. So here this linings is just 0.1 second. So on x-axis there is a time duration, there is a time duration. So it is 0, 0.1, 0.2, 0.3, 0.4 second, 0.5, okay, totally 0.8 second, okay, 0.6, 0.7 and 0.8. So in this 0.8 second, so many pressure and volume changes takes place in the atria and ventricles, and what are the changes we are going to see now. So first, as I said, you will first discuss about the atrial systole, okay. First thing we'll see the atrial systole. So what is the duration of the atrial systole? It is around 0.1 second. So in this 0.1 second, what are the changes that takes place, okay. So let me describe you in the with the line diagram, and we'll just take on the left side of the heart, that is the left atrium, and then we'll take the left ventricle, and from the left ventricle we'll take the aorta, okay. So similarly in the right side of the heart the same changes are taking place, but for the sake of better understanding we'll just take the left atrium, left ventricle and the aorta. Now this the wall between the atria and the ventricle, with the help of this blue color what I am highlighting right now, so this is known as AV walls or the atrioventricular wall. So more specifically it is known as mitral wall on the left side and tricuspid wall on the right side, okay. In between right and left right atrium and right ventricle it is tricuspid wall, this is known as mitral wall. Now, and the wall between the ventricles and the aorta, so it is known as semilunar walls. More specifically it is the aortic wall, okay. So it is known as semilunar walls, here in the aortic wall, and whereas from the right ventricle to the pulmonary artery it is known as pulmonary wall, okay. So anyway, now what are the changes that takes place, okay. First we'll see about the pressure changes in the atrium and the ventricles and the aorta. What will happen during this atrial systole of 0.1 second? So when the atria is contracting, what will happen? So when the atria is contracting, okay, now atrial systole means atria is contracting. So with this yellow color we'll try to show that now atria is contracting. So when the atria is contracting, the pressure in the atria slowly increases. So pressure in the atria slowly increases. Now pressure in the atria slowly increases. So this one, this marked dotted line, okay. So I'll just show it with the blue color thing, this small letter A. So now this 0.1 second is the atrial systole. Concentrate only on this duration. During the atrial systole, what are the pressure changes, okay. Now this thing which I am highlighting with this blue color is the atrial pressure change. So you can see there is a change, that is the pressure will increase in the atria. So when the atria muscle contracts, the inside the pressure will increase and it is marked as A wave, that is the atrial pressure wave. These are the mechanical events, right? So this there will be, first thing is A wave. So what are the changes that is seen in the atrial pressure? Atrial pressure, what is the changes seen is, first thing is A wave is seen. A wave is due to the contraction of the atrium. So the pressure inside the atria increases, okay, which can be seen as A wave in the JVP. So this atrial pressure, this right or left pressure, usually the right atrial pressure generally we consider as the jugular venous pressure, which will reflect the same JVP wave. So you might have seen that JVP waves, A, C, V and X and Y waves. A, C, V are the positive waves and X and Y are the negative waves. So the first positive wave in the JVP is due to this atrial contraction. A stands for the atrial contraction. So pressure here, so in the atria, it will rises. Okay, it will rises up to 6 to 7 millimeter here in the right left atrium, and in the left right atrium it will be around 4 to 6 millimeter. So the pressure first A wave in the JVP or the atrium. So it is the reflection, this one. So left atrial pressure is determined by passing the catheter, that is the left pulmonary capillary wedge pressure. Indirectly it is recorded, and right atrium directly by putting a catheter in the right atrium. Okay. Similarly, the pressure in the left ventricle or the right ventricle is by putting a catheter here, intracardiac catheter, and we can determine the pressure. So anyway, so A atrial pressure, that is the A wave is seen. Similarly, ventricular pressure. Ventricular pressure, what will happen during the atrial systole, that is this point 1 say, when it is contracting, the blood which is there in the atria, it will move into the ventricles. So it will move into the ventricles. So already there was 80% of the blood was there before this phase of atrial systole, but during this atrial systole it is pumped here, and the remaining 20% is pumped here, and the pressure in the ventricles, which was just from 0 to 2 millimeter, which was from 0 to 2 millimeter before this phase, 0 to 2 millimeter of mercury, the pressure increases here up to 7 to 8 millimeter of mercury. Okay, in the right atrium it will be around 6 to 7 millimeter of mercury. Okay, but when it goes the ventricles, the pressure increase to 7 to 8 millimeter of mercury here, like this. So I'll just show you this one, ventricular pressure here, ventricular pressure here. So almost similar to the atrium, just around 7 to 8 millimeter of mercury. So what are the changes here? In atria you will get A wave of the JVP, and in ventricular pressure, the pressure in the ventricles are increased. What about the pressure in the aorta during this period? So the pressure in the aorta, I marked it with the yellow color thing. So it will be around, it will be around 80 millimeter of mercury. So during this phase of 0.1 second, the pressure in the aorta is around the minimum pressure. So pressure in the aorta will vary from 120 millimeter to 80 millimeter of mercury. So during this phase 0.1 second of atrial systole, pressure in the aorta is around 80 millimeter of mercury, and pressure in the atria and ventricles are very less, around 7 to 8 millimeter. Okay, and it is the cause of A wave of the JVP, atrial pressure due to the atrial contraction. Okay, now after this atrial systole, the second phase which will start is the ventricular systole, that is the isovolumetric contraction period. Isovolumetric contraction period. Isovolumetric contraction period. Now, what changes that takes place during this phase of isovolumetric contraction period, and the duration of this phase is around 0.05 seconds. So in this 0.05 seconds, what will be the changes seen in the atrial pressure, ventricular pressure, we'll see. Okay, and also the volume changes we'll try to see. So in atria, in ventricles, and the aorta and the volume changes. So consider this as the left atrium, then we have the left ventricle, and from here the aorta will originate. Okay, so now this left, in between the left atrium and ventricle there is atrioventricular walls, AV walls, and in between the ventricle and the aorta there are semilunar walls. Okay, this green color are the semilunar walls. Now this isovolumetric contraction period, now what happens is during this atrial systole, the pressure in the left ventricle increased. The pressure in the left ventricle increased. So the pressure in the left ventricle which was increased, it causes the closure of the atrioventricular wall, because the pressure here is more as compared to this, the atrioventricular walls will close now. So the pressure causes the closure of the atrioventricular wall, and this closure of the atrioventricular wall causes the first heart sound. So first important event is first heart sound. First heart sound is due to the closure of the atrioventricular wall, and it is denoted by this segment B. Okay, it is noted by this segment B. So what happens is, during this next 0.05 second, concentrate only on this point, next 0.5 second. First was atrial systole, the second phase is isovolumetric contraction period, that is ventricular systole. These three lines denotes the ventricular systole, 0.3 second. Okay, then these four lines, 1.1 is this ventricular diastole, and that this one is also ventricular diastole. Totally 0.8 second. Out of that, 0.3 second is ventricular systole. So in this first part, 0.5 second, what happens is isovolumetric contraction. So first thing is, there is a closure of the semilunar wall. So at the end of the atrial systole, the blood which was pumped because of the high pressure here, it is closed. Okay, it will be closed here. So you can see the atrial pressure will be more than the ventricles. The atrial pressure will be more than the ventricles. So here this is the ventricular pressure, and this blue color is this atrial pressure. So slightly the ventricular pressure will be more as compared to the atrium now. So this atrial pressure, this B point, what does it indicate is, it is the first heart sound. First heart sound, and it is due to closure of the atrioventricular walls. Now after that, the ventricular pressure will increase this 0.5 second, from that 7 to 8 millimeter, it will increase up to 80 millimeter of mercury. So the ventricular pressure, first heart sound occurs, then ventricular pressure, what will happen is, there is increase from 7 to 8 millimeter of mercury, it will increase up to 80 millimeter of mercury. And the semilunar wall is already closed, and atrioventricular walls now closed. Now there is a closure of the atrioventricular walls. There is a closure of the atrioventricular walls. So since there is a closure of the atrioventricular walls and semilunar walls are not yet open, so whatever volume of the blood which is present in the ventricles, okay, whatever volumes of the blood which is present in the ventricle, now ventricle will contract. So this phase, it is known as isovolumetric contraction. Why it is known as isovolumic contraction period is, the volume remains same, because the input from the left atrium to left ventricle is absent, and from left ventricle to aorta is also absent. So ultimately the ventricles which are contracting, the volume of the blood is remaining same, because neither the blood is coming from atria to ventricle, neither the blood is leaving from the left ventricle to aorta. So the same volume, it is contracting, is known as isovolumetric contraction period, and it is around for 0.05 second, and here both the walls, AV walls and the semilunar walls, remain closed, and the pressure in the ventricles gradually increases from this one from 7 to 8 millimeter of mercury to here. Now because of the closure of the atrioventricular wall during this isovolumetric contraction period, it sets and vibration, it causes the first heart sound. We have already discussed. So first heart sound due to atrioventricular contraction, and this point B donates this one. Point B donates the closure of the atrioventricular wall. Now, because of this closure of the atrioventricular wall, there is a slight increase in the pressure in the right atrium also, which causes the C wave in the atria. So, C wave in the atria. So, C wave in the atria, you can see this is the atrial pressure. So, there is a slight increase in this phase. So, C wave is due to the contraction of the ventricles, which causes the pull of the this one atrioventricular wall. Okay, C wave is pull of the this one. Then we can see that there is a descent in the atrial pressure. That is, after this, the pressure, the atria is now relaxation. Now atria is relaxing during this thing, but still there is a slight increase due to the pull of the atrioventricular wall that causes the C wave. Then again there is a relaxation that is called as X descent, or the first negative wave, or the X descent. So what is the reason for this X descent is due to the atrial relaxation and the downward pull of the atrioventricular wall, okay, or the tricuspid wall or the mitral wall, that is the X descent. So the what the pressure changes in the aorta sorry, in the atrium what happens is there is formation of C wave during the isovolumetric contraction. There is formation of the C wave because of the closure of this atrioventricular wall, that is the bulge of this AV wall causes the C wave during the relaxation. And here in the ventricles the pressure increases. So in the atria what happens, there is C wave of the JVP is seen during this isovolumetric contraction period. Now the third, and what about the ventricle, this one aortic pressure? Aortic pressure here again it is still same, it is still same at 80 millimeter of mercury. It is not yet changed, aortic pressure is not changed because the semilunar walls are not yet opened. But at this point C, that is at the end of the isovolumetric contraction period, now since the pressure in the ventricles have increased, now it will increase more than the pressure in the aorta or pulmonary artery. So at the end of this isovolumetric contraction period, which the pressure from 7 to 8 millimeter, it increased to 80 or 81 millimeter, a point will come that the pressure here it is more than the aortic, this one, which will cause the opening of the semilunar walls. And this opening of the semilunar walls, it will causes the third phase, that is known as rapid ejection period, rapid ejection phase. Okay, rapid ejection phase, it is around 0.1 second, rapid ejection phase, that is 0.1 second. So what will happen in this, there is opening of semilunar walls, opening of semilunar walls. So opening of the semilunar wall is marked by this point C. So in this point C, what will happen during this period, there is opening of semilunar walls, that is aortic and pulmonary walls, semilunar walls. Now what pressure change takes place is from C to D in this rapid ejection period. So I will just mark here with this red color in the ventricles C and D, whereas atria is relaxing and you get a X wave. So in the atria pressure is dropping and in ventricle the pressure is increasing. Okay, and this increase ventricles, the pressure in the aorta is also increasing during this rapid ejection period. So this next phase is rapid ejection phase due to the opening of the semilunar walls. So let me draw what exactly happens here in the rapid ejection period. So this is the left atrium, then left ventricle, and this atrioventricular walls were closed. Now because the pressure increased in the left ventricle, so there is opening of the semilunar wall. So there is opening and the blood from the ventricles, it is pushed to the aorta. So the whatever pressure in the left ventricle, the same pressure it is there in the aorta. So this is the contraction period. So I will mark this with the yellow color, this ventricles. So during this period ventricle is contracting, not only contracting, it is pumping the blood to the aorta because of the opening of the semilunar walls, and the pressure increases from C to D. Okay, so D is the highest pressure here. So this red color thing what you are seeing is the pressure changes in the ventricles. This yellow color thing what you are seeing, pressure changes in the aorta. So aorta pressure and ventricular pressure is same during this rapid ejection period. Okay, now this D and E period is the slow ejection period and the end of the ventricular systole. This is ventricular systole, yeah, 0.3 second. Okay, so D and E is the next phase, that is the slow ejection period. During this slow ejection period, what will happen is the slow ejection period what will happen the pressure gradually decreases. Okay, that is the from highest point of 120 millimeter, it will gradually go on decreasing because the blood which is flowing out, it is moving now slowly. So the next phase is slow ejection period. The fourth phase is slow ejection period. Slow ejection period or slow ejection phase, which is around 0.15 second. So total duration of systole is 0.3 second. Out of that 0.05 second is isovolumetric contraction period, then 0.1 second is rapid ejection period, and 0.15 second is slow ejection period. So in this slow ejection period, what are the changes you will see is from atria to ventricles, the atrioventricular walls was closed. Okay, atrioventricular walls were closed. This is left atrium, this is left ventricle, and the aorta, okay, aortic pressure. So it will follow the left ventricular pressure. So from the left semilunar walls are still open, and the pressure, that is the blood which is, it is pumping out, but it is pumping slowly as compared to this. So the pressure here, it is moving down. Even the aortic pressure, it will follow the ventricular pressure. So even the the pressure in the aorta, gradually it is coming down along with the ventricles, that is up to this point E. Okay, now it will now the next phase is ventricular diastole. So during the systole period, only the semilunar walls are open and atrioventricular walls are closed, and the blood from the ventricle, it is pumped to the aorta. Okay, so atrioventricular walls are closed and blood is pumped. So in systole, first isovolumetric relaxation period where both the walls are closed, and the same isovolumetric contraction period. So during this isovolumetric contraction period, the ventricles are contracting when both the walls are closed. But ejection period, the semilunar walls are open and the blood is pumped out. Okay, now after this, ventricular diastole will start. That is the fifth phase of the cardiac cycle, that is the protodiastole. That is the first part of the diastole, protodiastole. So what will happen in this protodiastole? It is around 0.04 seconds. So in this 0.04 second, what will happen? Very important thing is there is a closure of the semilunar walls. Why it will close? Let me explain you. So, and it is also the cause of the second heart sound. So again, I will draw you the same rough line diagram. This is the left atrium, this is the left ventricle. You know that the atrioventricular walls were closed. These are closed AV walls already. The AV walls were closed, and aorta, okay, aorta semilunar walls were open, and the blood from the left ventricle, it is going. Now the ventricle, when it is relaxing, this atrioventricular wall is still closed, but there is closure of the semilunar walls. Why there is a closure of the semilunar walls during this period is, as it is relaxing, the pressure in the ventricle still goes down. Pressure in the ventricle still goes down, and it will go lesser than the pressure in the aorta. Okay, let me show you in this graph. So see, from this point, that is from this E to F, that is this protodiastole of 0.4 second. So now the pressure here goes down, and this F point indicates the closure of semilunar walls, and it is called as second heart sound, cause of the second heart sound. So during this protodiastole, the semilunar walls will close. Why there is a closure of semilunar walls? Because the aortic pressure, the pressure in the aorta, it is still more than the pressure in the ventricles, and because of that, the backflow of the blood causes the closure of the semilunar walls. Okay, and same thing, it is reflected as the dicrotic notch, okay, or incisura in the pulse tracing, that is known as dicrotic notch. We will discuss about that pulse later. It is related to this aortic pressure here. So this is known as, this depression, it is known as insura because of this closure of the semilunar walls, right? So that is the cause of the second heart sound. Then, so what happens during this protodiastole? The main event is closure of the closure of semilunar walls, okay, and what it is called as second heart sound. So usually heart sounds are there when the walls are closing, it will make a sound, a healthy walls. Opening does not make sound, closing makes a sound. So when this atrioventricular walls closed, it causes first heart sound. When this semilunar walls close, it causes second heart sound. It causes the second heart sound. Now, protodiastole, just 0.04 second, most important event is closure of the semilunar wall. So, because of the closure of the semilunar wall, now the next phase of the ventricular diastole is, that is the totally the sixth phase. Here is the isovolumetric relaxation period. Isovolumetric relaxation period or isovolumetric relaxation phase, which is around 0.06 seconds. So what happens during this time is, since the atrioventricular walls are already closed, this is left atrium, this is left ventricle, and again aorta. So atrioventricular walls were already closed and the semilunar walls are now closed. Because the semilunar walls are closed, AV walls are closed, whatever the volume of the blood which is remaining in the ventricles, the volume will not increase or decrease, because the input is also closed, output is also closed. So that's why it is called as iso, means same, isovolumetric relaxation period. So it will relax as a closed chamber where there is no entry of the blood and there is no exit of the blood. So it is known as isovolumetric relaxation period, is 0.0 second. So what the pressure changes in the ventricles, what you will see is, see this one. So the pressure from here, it will go to this point G, that is during this isovolumetric relaxation period, the pressure fall here from F to G, this segment. So this slowly it will fall, right, from around 110, yeah, up to 82, it will come back to 20, or it is still further reducing. So this is known as isovolumetric relax. So what are the pressure changes? The pressure will decrease here, ventricular pressure will decrease in this phase. What happened to the atrial pressure? Simultaneously in the atria, you can see there is increase in the pressure. Why there is increase in the pressure? And it is marked by this wave V. Okay, so in this period of atrial diastole, there is marked V. V is due to venous filling. V is due to venous filling. So since the atrioventricular walls are closed and from the pulmonary veins, okay, the blood is pumping from these great veins, pulmonary veins in the left atrium and even in from the right atrium, the superior vena cava and inferior vena cava. So blood is coming in the right and left atrium. So these great veins, which is causing the accumulation of the blood here, so that filling in the atria causes a wave, and that wave is reflected as wave in that. So this, it is what I am showing is the pressure changes in the atria, this blue color thing, small. So first was the A wave, then C wave due to tricuspid wall, and this V wave is through the venous filling, okay. And slowly in the next phase, that is this phase is the ventricular diastole only. Again there is a descent here due to the opening of the AV wall. So this point G is the opening of the AV walls or atrioventricular walls, opening of AV walls. So what happens due to this opening of the AV walls? Now after this isovolumetric relaxation period, that is the sixth phase, and there is increase in the venous return, it causes the V wave in the uh, atrial pressure changes or the JVP. Now the next important phase is rapid filling phase. Rapid filling phase. Rapid filling phase, which is around rapid filling phase, which is around 0.11 second. So in this rapid filling phase, what will happen is, let me write it neatly. Rapid filling phase. Rapid filling phase. So in this rapid filling phase, what exactly will happen is, the blood from the ventricles, sorry, blood in the atria will enter into the ventricle, and there is opening of the atrioventricular valves. Why there is a opening of the atrioventricular valves is left ventricle, and again there is aorta. So this atrioventricular valves will open because the pressure in the left ventricle now decreases further than the atrium, because atrial pressure is increased due to the filling, and here there is opening of the atrioventricular wall, and the blood from the atria will rapidly enter here into the left ventricle slowly, and the pressure in the left ventricle, it is reduced. So, I will come back to the same graph once again. So, from this opening of the atrioventricular wall, the pressure will go down here to 0 level almost. This is G curve. Okay. So, this G curve, G and H, this segment represents the rapid filling phase. Okay. And this rapid filling phase, that is that will because the blood is moving down, so the pressure in the atria is also reduced. So this is the cause of the Y descent or the Y wave, that is the negative wave, that is the filling of the blood from the atria to the ventricles. So the pressure in the atria also decreases, and even in the ventricles also decreases. Both are in now diastole. So this blue color is the pressure changes in the atria, this red color is the pressure changes in the ventricles, and this yellow color is the pressure changes in the aorta. So this rapid filling phase of 0.11 second, you can see this. Then last one is the slow filling phase. So slow filling phase, which is around 0.2 second, it is 0.19 second, it is the almost the last phase here. So that is the 8th phase here. So it is the slow filling phase, which is around 0.19 second. So in this slow filling phase, again the same thing, the blood from the left atrium to the left ventricle, it is entering, and there is a closure of the semilunar valve. So it is entering, and the left ventricle is relaxing, and the pressure further it is maintained slow. And this phase, it is also known as diastasis. Because it is like stasis. So here the pressure in the atria and the ventricle is almost same. So it will become like one complete cavity. The whatever pressure in the left atrium, the same pressure is in the left ventricle. So like diastasis, the blood is moving here. So during this rapid phase and the slow filling phase, around 0.3 second totally. So the around 80% of the blood is pumped from the atria to the ventricles. 80% of the blood which is collected in the atria is pumped to the ventricle without any atrial contraction. During the atrial contraction, only just 20% extra blood will be ejected. So what is the clinical significance here is, even if the atria is not working, then also the blood is capable of pumping from the atria to ventricle during this rapid and slow filling phase. Okay, during the last rapid filling phase, which coincide with the atrial systole, if you remember the first thing, last rapid filling phase which coincide with the atrial systole, only around 20% of the blood is pumped. So in a normal healthy person, if the atria are not working also, a person can lead a normal life, there is no much difference is seen. But when the person do exercise or some exertion, then only their symptoms are visible. Okay, so this atrial contraction will causes the only 20% of the blood from the atria to the ventricles to be pumped out, and remaining that 80% is already pumped out by the rapid and the slow filling phase. Okay, so let me revise you what we have discussed till now. What are the pressure and the pressure changes in the atria, ventricle and aorta. Okay. So first you should know the phases. Okay, just a summary is very important. So see what we have discussed now. So what we have discussed, atrial systole 0.1 second, atrial diastole 0.7 second. Okay, ventricular systole 0.3 second, ventricular diastole 0.5 second. Ventricular systole has these three phases: isovolumetric contraction period and ejection phase, rapid and slow ejection phase. Then we have ventricular diastole, protodiastole, isovolumetric relaxation phase, rapid filling phase, slow filling phase. The duration we have mentioned, and this last rapid filling phase, which is of 0.1 second, coincide with the atrial systole of 0.1 second, right? Now we have discussed about the different phases. First is this atrial systole 0.1 second, which coincide with the last phase of the ventricular diastole 0.1 second. So during this phase you can see the atrial systole, that is this red color thing. There is, when the pressure in the ventricle from 0 to, it will increase to 7 to 8 millimeter of mercury, whereas in the atria also it will increase, and it is a cause of A wave in the JVP, or the pressure A wave in the mechanical event in the atria. Simultaneously, this one yellow color, this is the pressure that is around 80 millimeter in the aorta, right? Now, during the second phase, that is, this is the ventricular systole. Ventricular systole first phase is isovolumetric contraction period. So isovolumetric contraction period, both the walls were closed, because at the end of this atrial systole, first heart sound, it is atrioventricular walls are closed, and ventricular semilunar walls are already closed. So the pressure from 7 to 8, it will increases to 80 millimeter in the ventricles, and due to the bulge and closure of the atrioventricular wall in the atria, we get the C wave. C wave is due to the contraction of the ventricles. So bulge of the atrioventricular wall causes this C wave. Now, because of this, there is again at the end of this opening of the semilunar walls, and when the open of the semilunar walls, the blood is ejected from the ventricles to the aorta, and the same pressure continues in the aorta. This yellow color is aorta, red color is ventricles. So this D is the maximum point up to 120 millimeter. Now from this slow ejection period, the pressure gradually decreases. So in ventricular systole, the pressure from 7 to 8 increases up to 120, and again it will gradually come down to nearly 80. So in the ventricular diastole, when the ventricular diastole starts, so the pressure decreases because of the closure of the semilunar walls. That is the second heart sound, that is after the protodiastole. Okay, after the protodiastole, closure of the semilunar walls causes the second heart sound, that is this in protodiastole. Then second one is this FG is isovolumetric relaxation period. Then from G to H is the rapid filling phase, then reduce rapid filling phase, or the slow filling phase. Okay, so this is 0.8 second. Again, this will continue. So this is graph, blue color is atrial pressure changes, this red color is the ventricular pressure, and this is the aortic pressure. Now most important now is the volume changes. So see what happens during these different phases. So this is atrial systole. During the end of the atrial systole, or the this one, this is the end systolic volume. So at the end of the end systolic and end diastolic volume. So this is the before the start of the systole. This is the 130 millimeter is the end diastolic volume. What is this end diastolic volume? That is at the end of the diastole in the ventricles and diastolic volume. So in the ventricle, after the ventricles relaxes, so the volume will be 130 millimeter, 130 ml, sorry, 130 ml. So when the, okay, I will just draw this ventricles, atria, ventricle. So this is left ventricle, then aorta. So end diastolic volume is 130 ml. So 130 ml is remaining after the end of the relaxation. Now when the ventricles will contract, and during the rapid filling phase, out of this 130 ml, around 80 ml is pumped from this ventricle into the aorta, 80 ml. So this 80 ml which is pumped from the left ventricle to the aorta, it is known as stroke volume. So in each stroke or in each ventricular contraction, that is known as stroke volume, and the volume which is remaining in the ventricles after the contraction, it is known as end systolic volume, that is around 50 ml, that is 130 minus 80. Out of that 130, 80 has gone out and 50 is remaining here. Okay, that is known as end systolic volume. Okay, and this is also known as the ejection fraction, that is the amount or the percentage of the blood which is pumped out of this total one. So it is around 65% of the blood it is pumped out, that is the normal ejection fraction. Okay, so the volume changes in the ventricles also you should know. So end systolic volume and diastolic volume 50 ml. So and out of this again 80 ml which is pumped out, okay, which is pumped out, that is the stroke volume. So this is the volume changes. Now first heart sound I have said you due to the closure of the atrioventricular valve, second heart sound due to the closure of the semilunar valves, that you should know, it coincide with this point. G point is, F point is the closure of semilunar valves, first heart sound is B point. So first heart sound, second heart sound. Then something known as third heart sound, okay, third heart sound takes place here in the diastole. So because of the ventricular filling, so in a normal healthy person will not hear a sound, but in children or in some disease condition where there are ventricular filling is too much, third heart sound is seen. And in fourth heart sound during the atrial systole. So in diseased condition, this third and fourth heart sound is not generally heard. So when the heart, that is the atria, is pumping the blood against the hypertrophied ventricle, it will create a sound that is known as fourth heart sound, which when audible usually pathological. First and second heart sound with the help of stethoscope we can normally hear in a normal person. Now if we compare this with the electrical events, so as you know, P wave is due to atrial contraction, atrial depolarization. So electrical event precedes the ventricular event. So P wave before the atrial systole, so before the A wave, that is the mechanical contraction, and QRS complex is the ventricular depolarization, that is the electrical event in the ventricle. It will precede the ventricular changes of the mechanical changes of the ventricles, okay. And T wave is the ventricular repolarization. So finally I'll come back to the main diagram which I have showed you initially. So this diagram you have to explain in the cardiac cycle. So this one is this what I am showing is the pressure changes in the ventricles. So from 0 to 120 millimeter of mercury it will go during the 0.8 second. This is the pressure changes. This is the systole, this is the diastole. Systole 0.3 second, diastole 0.5 second, okay. Again systole 0.3 second, again diastole. So this is in this one cardiac cycle. This is first is the pressure changes, then this is the volume changes. Volume changes, that is from 50 to 130. 50 is the end systolic volume, 130 is the end diastolic volume, okay. Pressure and volume changes, normally the question will be pressure and volume changes. So this one, this is the pressure change of the ventricle, this is the volume change in the ventricle. Simultaneously pressure changes in the atria is this dotted line. You have to explain that ACV positive waves and X and Y descent, why it will occur, and you have to correlate this with the normal ECG, okay. This is P wave before the atrial contraction, then QRS complex before this ventricular contraction, and also you have to explain this first and second heart sound. First heart sound due to closure of the AV valves, and second heart sound due to closure of the semilunar valves, okay. So with this we have completed this cardiac cycle, and let me explain this same thing, definition, phases, and objectives: pressure changes in the ventricle, atria, aorta, and the volume changes in the ventricles, okay. Video is too long, so if you like our explanation, please subscribe our channel Doctor's Corner and share the link with your friends. Thank you.